Good morning. I am here to do my eye assessment ret video. So, good morning, sir. I am Daniel Joseph Pospos, and I'm your student nurse for today. May I know your name, please? All right. Good morning, Sir Ibo. I am here to do an eye assessment. This procedure is to know underlying problems or to identify any potential abnormalities within your eye, and this is also to know your visual acuity. So in this procedure, sir, I will be touching you. Would that be okay, sir? Right, so this thing we'll do is gather materials needed, and let's wash our hands. So first thing we'll do is test near vision of the patient. So get any kind of reading material and read the patient. Let the patient read what is its contents, and before anything else, identify the patient's ability to read and education level. So, sir, makabalo ramon ka mo basa, sir, sa? Makabasa na ka ni sir. Ani, sir, basa daw ni sir. Basaha, sir, basaha.
Write all answers on a one whole sheet of paper.
So, the patient was able to read the article within a distance of 14 inches. Then, next thing we'll do is the distant vision test, the far vision test. So, let the patient stand away 20 feet from the Snellen's chart. So, sir, bahin ta, sir. Dito lang talingkod, sir. And let the patient read the Snellen's chart. So, sir, sugod ta, sir. Igna ako kung sa nga letter niya akong gipoint, sir, ha. Then cover mo sa kamata, sir, sa imong left. Ana. Kani, sir?
E, F, P, G, O, Z, L, P, E, D, P, E, C, D, G, E, D, F, C, Z. I can't see now.
So, layo ra kay ka, sir. Dol ta gamay, sir. Okay, gamay ning atong Snellen's chart. Dol ta gamay. Dali ta, sir. Sige, usog ta, sir, ha.
Yes.
Tabuni mong kuan, sir. Right eye. So, sige.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, T, Z, D, D, E, F, P, O, T, E, O. Can't see now.
Di na makakaraw.
Di na makakaraw.
Alright, so the patient's OS or oculus sinister is 20/20. Then, sir, tabo na po sa imong usang mata, sir. Then, usog ta.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, P, E, F, C, Z, P, F, E, L, O, P, O, P, E, C, L, E, F, O, D, G.
So, the patient's OD is also 20/20 or the oculus dexter. So, rationally is the patient's OU or the oculus uterus Q is 20/20. And next thing we'll do is the color vision test. So, sir, unsa ni nga color, sir?
Green,
Kani?
red.
Alright. So, nakoy palantaw nimo, sir.
Okay.
ina ako unsa ni nga number makita sir ha.
Okay.
Saan na nga number sir?
1.
Or 1. So the patient was able to identify the color that and the figure that I have shown for the patient. So the patient has no color blindness or anything. Then next thing we will do is test for the patient's visual fields. So sir, balinta diri sir. You must stand patient's eye level. So position yourself in the patient's eye level. Then let the patient gaze that straight at you. Sir, lantaw lang ako sir ha. Yung tabunin yung isang mata. Then ayog lantaw na ako sir yung sa ballpen. So okay. So igna ako sir if makita na nimo kani nga ballpen pero straight to japo lantaw na ako.
Kita.
Kita na. Dere.
Kita.
Dere.
Kita.
So pikas tabo yung pikas mata sir. So igna ko ayog lingit ra nako. Na.
Kita.
Dili sa itsa. Lingit ra nako.
Kita.
Ina ko kung saan yung makita ha.
Kita.
Sige.
Kita.
Alright, so the patient's peripheral vision is still intact and on both eyes and in all fields. So the next thing we'll do is inspect for the assess for the patient's external structures. So first thing we'll do is inspect the patient's general appearance of his eyes. So the patient's eyes are smooth, clear and bright and is parallel in alignment. Then the next thing we'll do is inspect for the patient's eyelashes for its distribution and if it's inverted or reverted. So patient's eyelashes are present, then it is inverted. Then next thing we'll do is assess for the patient's eyelids if there are any masses or lesions that is present or any. So there are no present of any lesions and no masses or any infestations that is present. The next thing we'll do is inspect for the patient's eyeball protrusion. So the patient's eyeball is protruded but it does not go beyond the frontal bone. The next thing we'll do is assess for the patient's lacrimal glands and nasolacrimal ducts. So first thing we'll do is inspect for the patient's lacrimal ducts, lacrimal glands, and see for any redness or swelling, and inspect for the patient's nasolacrimal glands for any kind of drainage. So there are no drainages present. Then after inspecting, you palpate the patient's nasolacrimal glands for any kind of masses or nodules or any kind of swelling. So palpate the patient's nasolacrimal duct and the patient's lacrimal glands. So in palpating the lacrimal glands, we will palpate under the patient's eyebrow. So palpate under the patient's eyebrow. The next thing we'll do is palpation of the nasolacrimal glands. Palpate the patient's near the inner canthus of the eye. So there are no lesions or any nodules or masses that has been palpated. The next thing we'll do is inspect for the patient's bulbar conjunctiva and palpebral conjunctiva. So, sir, wait lang sir ha. Ano sir? Then, in inspecting the patient's palpebral conjunctiva, we need a cotton bud to help in inspecting. Gamay lang sir ha. Riyot lang sir. Erog ka look sir. Ano lang sir. Yeah, tayong tikas mata sir. Erog kuhan sir ha. Erog ka hadlock. Ganun sa pit. Alright. So, the patient's conjunctiva is smooth and glistening, and there are no presence of any foreign objects, and it is pinkish peach in color. So the next thing we'll do is inspect the patient's sclera. So the patient's sclera is white and it is smooth and glistening. Then next thing we'll do is assess the patient's cornea, and let's put a light 15 degrees towards the eye of the patient, and note for any abrasions or unclarity. So the patient's cornea is clear, smooth, and glistening. Then let's check for the patient's corneal reflex and blinking reflex. In checking the corneal reflex, we will make use of our cotton buds and put it in the gently touch the patient's cornea with these cotton buds and note for blinking and tears. So karit lang sir, gamay lang sir. Alright, so in assessing for the blinking reflex, we'll brush our index fingers and the patient's eyelashes for both eyes and note for blinking. So positive corneal reflex and blinking reflex. The next thing we'll do is inspect for the patient's iris. So the color of the patient's iris is brown, then it is shape is circular, and it is bilaterally equal inside. Then next thing we'll do is assess the patient's pupil. Then in assessing the patient's pupil, we will make use of our pen light. Sir. So the patient's pupil is 3 mm in size, and upon stimulus of the light, the patient's eye is constricts to 1 mm, and and it has normal consensual and direct reaction of the upon stimulus. Then next thing we'll do is assess for the patient's ocular accommodation. So sir, lantaw aning akong kamot sir ha, kaning akong kamot ng lantaw sir. Lantaw lang sa akong kamot sir. Okay, malibat ka sir. Alright. So the eye converges in the middle upon nearing my finger the patient, and also the pupils constrict when my fingers moves closer to the patient. Then next thing we'll do is palpate the patient's eyeball for firmness. So sir, tingnan sir. So patient's eyeball is firm. Then next thing we'll do is the ophthalmoscope examination. In this case, we'll stand 15 degrees from the patient. Then put our free hands on the patient's head to maintain the distance. And this is to check for red reflex on the patient's pupils. Then turn on the lights. Then do it on the other side as well. Turn the light. So red reflex is positive on pupil area of the patient. Then after doing so, remove your gloves, wash your hands, then document the data that is recorded. Then that would be all. Thank you.